Good morning. Again, welcome to this series of Decoding Obesity, the outcomes of the treatments and the impacts of the disease. After the heart and the lungs, let us try to understand what is the impact of this obesity on the complete breathing apparatus of an individual. The breathing apparatus consists of the nose, the throat, and then the lungs, supported by the heart. In an obese person, we observe many times that they are unable to breathe well even while sitting, and this gets worsened when they are lying down. What happens typically is they start snoring a lot. You may be seeing people who snore a lot even while sitting or while sleeping. The most common thing in them is the complete central obesity or the large central obesity. How does it contribute? The central obesity, as we said, will decrease the lung capacitance, will put even the apparatus under a lot of stress because of high oxygen demand. At the same time, it is accompanied by the large neck, which is again creating a lot of obstruction or hindrance to the complete breathing pipe. And this leads to the demand to supply equation which goes wrong in the body, wherein the body will start using all the accessory muscles to help the oxygenation, and that is where people will snore a lot. In the initial stages of snoring, people will snore but they may not realize it. In the next stage, they snore and they understand at certain point of time that there is suffocation, a lack of oxygenation, or they will want more ventilation. They will say, I am feeling suffocated. They will change the position. After the change of position, they will have some kind of relief of that oxygen deficit. After some time, in the next stage, this relief gets not sorted with the change of position, but one has to sit, one has to do some breathing activity, one has to walk, and then only get the relief. In the next stage, there is a lot of trouble adding into this, where a person may stop breathing for some time during the sleep. This is called as the apneic spells. The apneic spells can get prolonged and prolonged with the severity of the obstructive sleep apnea, and at times can lead to sudden death during the sleep. In the obese patients, severe obstructive sleep apnea is one of the commonest causes of sudden death during sleep.